Minister, Dr. Joe Phaahla, says all hospitals should be exempt from rolling blackouts. However, at the moment, just 10% are.
He says that his department is working on resolving this problem. He's also looking at harnessing renewable energy to mitigate the effects of power cuts. Phaahla visited Witbank in Mpumalanga to assess the impact of outages on healthcare facilities. Now, reporter Heidi Giokos was there and filed this report.
You understand that only 10% of hospitals nationwide are exempt from load shedding, and this is a big concern for the Health Minister. But let's bring him in together with the MEC of Health in the province. Thank you both so much for your time. Minister, let's just speak about your earlier briefing today where you said that only 10% of hospitals are exempt from load shedding. This must be a big concern for you given the fact that we don't know when load shedding is ever going to end, and now you are going back to National Treasury to say you need more money because most hospitals have gone through their diesel budgets.
Well, definitely it's not a very good situation that the load shedding, instead of going down, remains quite high. I mean, as you know, we are either most of the days stage 3, stage 4, the worst of times stage 5, stage 6. So that really is putting a lot of strain on our emergency power supply of generators, because they were never meant to supply the hospitals over long periods and to supply the whole hospital. So these are, as we call them, standby emergency generators. So at this stage, even in terms of the consumables, which is the diesel, the oil, the maintenance of the generators, we budget on the basis that it's going to be just standby and for emergencies. So that's why here in the province, I'm sure MEC can confirm, and the reports the DG brought after meeting with all heads of departments everywhere in the country, there is a lot of stress in terms of high consumption. And now that you're mentioning that the diesel, notwithstanding that petrol is going down, diesel is not going down, so that means a lot more pressure, and that's why we really want to hope that our colleagues in the Treasury will be kind to us so that we can get some adjustment.
But this is unsustainable, because how much money can actually be given to hospitals just to keep generators going? Surely there should be other alternatives. And maybe we can pose the question to you about the pressure that you have as the National Health Department to say to Eskom and government officials that this is a crisis and they need to understand that hospitals should be exempt. Firstly, are you speaking to government and putting pressure on them because of the pressure you are feeling? We're talking about lives here. Secondly, what about other sources of energy that you could consider to have these hospitals powered instead of relying on Eskom?
Well, firstly is to push for, we're happy that we are engaging. There is positive movement. It might look slow. Obviously, we would have wished far more than just 10% of our hospitals to be exempt. We are pushing, as I mentioned this morning, I've given instructions to the DG and also to our team of finance and technical infrastructure people to work very closely with Eskom. We will be, all provinces are submitting their priority. I mean, ideally all just over 350 or so hospitals should be exempt, but we want, as agreed with Eskom yesterday, to also put them in terms of higher priority. Obviously, the central hospitals where you take most of your referrals, you are very sick, where major operations are done, those should be priority. Tertiary hospitals for each province, like here, Witbank, Rob Ferreira, everywhere else in Limpopo, Polokwane, Pietersburg, Mankweng, all of them, some of them already exempted. So in that hierarchy, but we will be pushing, and I'm quite, positive that I can guarantee the support of the President, of my colleagues in the Cabinet, including the Minister of Public Enterprise. We speak regularly, and he is very supportive. So we want that route, but also, as you said, we want to also immediately, some of the team members are here. We have given them very clear instructions to work on alternative energy sources. We are working immediately on solar, on batteries, lithium, whatever, all the technical issues. So they are working on a plan. which we want to roll out as soon as possible. At least beginning of the next financial year, we must be rolling out alternative energy sources.
Okay, great. Thank you so much. Let's bring in the NEC. You have your boss here today assessing all the hospitals and clinics. This must be a lot of pressure on you, especially because Witbank Hospital is a hospital where you possibly might be needing a lot of more resources. If you could just tell us about the need for more resources in the province, not just here in Witbank.
No, thank you very much. And indeed, as a province, we welcome the visit from the minister. And the manner in which he structured his visit is that last week he brought the whole team of his managers to come and meet with the management in our province to look at the province as a whole. It's not about just maybe because he's visiting clinics at Emalahleni, but to look at the whole province in terms of your infrastructure, your human resource, your finance, so that he can say what is it that we can do. And when he then came, yesterday we spent the whole day, and the manner in which the national and the provincial government were working in terms of presenting as one government in terms of what is it that we can do, trying to assist at the national level, because like I'm saying, your human resource, finance, infrastructure, all managers together with the province, looking at the province and to say what can be done in terms of intervention to make sure that we provide the quality services that our people are looking for. It's something that we are seeing for the first time, and we really appreciate, because with the limited resources, both province and nationally, will make sure that the lives of our people are better and improve their lives.
Okay, in just 30 seconds, are you feeling the pressure of load shedding? Would you want for Mpumalanga to be completely exempt from load shedding?
Yes, you know that in terms of your diesel and generators, those are emergency, as the minister said. In terms of the budget also, you can't budget for like replacing ESCOM. So we have already even taken a report to provincial treasury, because we no longer have got enough budget to deal with the load shedding. So as you are correctly saying, that it is a problem for us, because if you must service those generators, and anything can happen in terms of the Department of Health, once you'll find that maybe the generator is not in good condition and load shedding. So indeed, we appreciate that the minister is intervening so that at least we can be exempted in terms of not having load shedding in our facilities.
Okay, great. Thank you both so much for your time. We do appreciate it. That is the Minister of Health as well as the MEC of Health in the province.